all put together, this is, I think, a very effective approach I found with my patients, and hopefully could be effective for you as you figure out what's going on for you, people you love, and what you want to do. In this episode, I want to address some clinical intervention ideas to address the most common emotional mental health challenges of anxiety and depression, which of course is the name of this series on anxiety and depression. So overall in my practice, what I've come to learn is that there are three basic things we want to do to help people with anxiety and depression. It comes down to love, change, and maybe serotonin. So love our caring relationships, and I'll talk about soon mutually caring relationships. Change is changing circumstances and situations that are very stressful and toxic to a person. And lastly, serotonin maybe when it comes to brain health, which I'm going to talk about right off the bat, because if we do need to change our brains in terms of what's happened from toxic stress through serotonin medication, it is incredibly helpful. So within this episode then, I'm just going to break all of that down into three parts, which is brain health, and then psychological health, and then relational health. So first with brain health, as I've said repeatedly on this channel, is that there are different kinds of anxiety and depression. There's generalized anxiety and situational anxiety, as well as generalized depression and situational depression. So what we found, what the science tells us, is that when living in toxic stress or high chronic day-to-day fear for a long time, maybe over a year, what can happen in our brain is the amygdala grows larger because it's supposed to put a person on guard, and the hippocampus can grow smaller to sort of modulate this sort of severe emotions going on. When that happens, we as humans tend to end up with what we call, and it's incredibly uncomfortable to live with and we want to change it, but we end up with things called generalized anxiety disorder, as well as generalized depression, which is one type of depression, that being the type of like, I feel vacant, I feel empty, I just don't feel anything. And then there's also this compelling evidence from science and from my practice I see literally every day when people need it, is to talk to their doctor, talk to your medical provider if you're watching this and want to look into it. Because if you have generalized anxiety or generalized depression, serotonin-based or serotonin medications shrink the amygdala to eliminate the generalized anxiety or increase the size of the hippocampus to eliminate that type of depression. It just works. And so again, if you or you know someone and this is going on, talk to the medical provider, your medical provider, to see if that's the right option for you. Now, other brain health related strategies are basically changing the stress, the cause of the stress, because that helps the brain, as well as mindfulness-based stress reduction. And science helps us understand that helps the brain and why, as well as exercise. Again, science helps us understand and why, and people know this with their experience, that those things tend to help people feel better. And we know that it helps the brain to some extent in changing that as well. So those are other brain health recommendations that I often make to people here in my practice. Next for interventions are psychological interventions or psychological health. Usually in psychotherapy, we talk about a broad category called cognitive behavioral treatments. And most of our treatments fall into that category. The cognitive side is changing what you think or actually what you believe, and the behavioral are changing your behaviors, your actions, and what you do. Both when those can change, they can absolutely increase joy and pleasure and happiness and contentment and address the effects of anxiety and depression. So psychological health is the other out of the three, second big part of understanding how to intervene for things like anxiety and depression. Now, there are a lot of CBT or cognitive behavioral therapy programs out there, like especially with exposure therapy for things like fear of heights or fear of snakes or fear of things like that. There's trauma-centered therapy in terms of understanding trauma, PTSD, what's happened. It's a really good therapy for that. There's also dialectical behavioral therapy, which is, I think, great for so many things. It's designed for certain personality disorders, but it's great for everything because it helps people understand themselves and their emotions and relationships so much better, so much healthier. In my practice, I really talk about, understanding emotions and understanding oneself to the best extent possible. So understanding oneself is self-esteem and self-perceptions, how relationships, whether they're toxic or caring, and situations, whether they're toxic or caring, affect a person and their self-understanding, their self-perceptions and self-esteem. I also talk a lot about emotional understanding and understanding primary emotions, emotional responses, emotional management, understanding that emotions are natural responses to your environment, that emotions change, and they do understandably for survival and living successfully. And then with all of that, how to really understand one's emotions on a day-to-day basis and manage them really well as they happen. And they need to be managed because a lot of times we're just feeling not very much, or we're feeling pleasure, we're fine. But other times with especially fear, anger, and sadness, they may grow so large we need to manage them well in the moment. So that's a big part of my practice. And you'll see then episodes in my series here about primary emotions, PTSD, toxic stress, all those things related to emotional management. I'm also a big fan, and what helped me understand emotions even better was the Unified Protocol at the Center for Anxiety and Related Disorders at Boston University, because they've done decades of research. They talk about emotions being, based in nature, our natural responses. There's all this science behind it, and all of that. And they have these manuals that help people read them, or therapists use them to help people lead to their best treatment and recovery. And there's one particular quote that I'll read, put here in the episode, that really makes so much sense to me, and it really was very influential in my thinking and how I approach my practice with patients here. And that quote is, "At their core, all of these disorders, especially depression and anxiety, arise out of a tendency to experience emotions more frequently, more intensely, and as more distressing than someone without these disorders." Basically what that means is, if we're feeling a lot of fear, a lot of sadness, especially, that they can grow and be more dominant in a person's life, in anyone's life, any one of our lives, to become a challenge. And that's what they're talking about. And the Unified Protocol is saying they're all together. These emotional difficulties, challenges, they're all together. They're not just separate labels of anxiety and separate labels of depression. Is that they're all together, they're emotional challenges because of life and how our brain and our body, our self, our psyche has reacted to all those things in life. Last and finally, I want to focus on relational health. Again, brain health, psychological health, and relational health. So relational health has its basis in understanding biology and evolution, that relationships are key to our human survival and the survival of many other animals on the planet, but we know them to be key to our survival. Attachment theory in psychology was really helpful for us to start to understand exactly how and why relationships are important. Object relations theory in psychology was also helpful in the progression over the last century for us to understand relationships and what they mean to us. I'm a big fan of a couple of things too. There's a Center on the Developing Child at Harvard. Talks specifically about serve and return. They talk about that between infant and mother, but it really is between every human, or humans together, is serve and return, or putting out carrying messages and support, getting it back and forth, serve and return. It's key to our understanding of our relationships and how central and important they are. And to quote them, they say, relationships are the active ingredients in building resilience. And by that they mean mental health, strong mental health, as well as strong mental health to adversity. Also from Harvard, there's also this longitudinal study of over 75 years with hundreds of men collecting data on them and their lives and what makes them tick and everything about them. And what they concluded is the following. They found the warmth of relationships throughout life has the greatest positive impact on life satisfaction. And what they mean by that, it didn't matter about money, power, prestige, status, everything else. It's the warmth of positive, caring relationships that mattered the most to positive life satisfaction. I just think that's one of the best studies that tell us what's going on for us. Now, from my training, and what I've used now for over 2 decades, is the principles from the relational model at Wellesley College. And in that relational model, they state this: an increased capacity for engaging in mutually empathic and empowering connections. Those are the keys. Those are the best to building best mental health and to understanding ourselves and to also dealing with things we call anxiety and depression. And in my practice, I translate this, what they talk about in terms of engaging in mutually empathic and empowering connections, I call it mutually caring relationships. That is a really common, simple language understanding of what we do the best from or by. Mutually caring relationships are we care about each other, we believe in each other, and we support each other. And by that I mean, when we care about each other, there's a genuine affection. There's a genuine affection between us. When we believe in each other, we believe that we can succeed. We don't judge each other. We absolutely believe in the other person's ability to make it well in life and just absolutely believing them and not judging them. And then the last thing is we support each other. So when we need support, we're there for each other. We are there for each other when stuff happens and we need someone to listen. So those 3 things define excellent mutually caring relationships. Now, on the last one, on the support, there's also another thing to follow, and that is the love method. And when we do that, our relationships are incredibly strong. Because in supporting people with the love method, which is LUV, listen, understand, and validate, that's really listening to someone, really hearing them. And understanding is like knowing what they're going through. I mean, just getting it. If you don't know, you ask questions. And there's nothing about your agenda in this conversation. That person is just telling you what's going on. You're asking them more questions. And then ultimately you get to the point where you validate. Wow, that must have been really hard for you. Or conversely, that must have been awesome for you. That must have been great. And so in understanding this together, we can be incredibly supportive for each other. That leads to, in fact, the mental health of mutually caring relationships. It really is, psychological health is really important and brain health is foundational, but relational health, mutually caring relationships are where we are the healthiest and find the best mental health. Finally, to say that in terms of primary emotions, is that mutually caring relationships lead to the greatest experience of joy, of happiness, pleasure, and contentment. Again, building strong mental health and resilience or strength. And that resilience is best understood in resilience to fear, anger, and sadness, the other primary emotions, or what we can experience in life based on situations, toxic relationships, and the like. So, all put together, this is, I think, a very effective approach I found with my patients, and hopefully could be effective for you as you figure out what's going on for you, people you love, and what you want to do. So in the end, I hope this has been helpful because you deserve it and you are awesome.